Please, guys, let me know. Guys, please, guys, if you see me online, Facebook, please, guys, let me know. Thank you. Okay, guys, am I on Facebook Live, guys? Please let me know. Let me check our Facebook page, guys. Let's open this one. Okay. Guys, am I audible to everyone? Guys, am I audible to everyone? Okay, guys. Now I see that I'm live on Facebook, and then I see you guys there. Before I start, I would love to check with every one of you guys. How are you doing? How is every one of you guys going? Okay, guys, let me check now. Your comments. Let me share. Where can I share right now? Okay, guys, I see your comments right now. Dr. Natalie. Hi, Dr. Natalie. How are you going? Hi, Dr. Shama. How are you going? Dr. Magda, how are you going? And hello, everyone. Big heart for hello, everyone. Big heart. Big heart. Hi, Dr. Sandra. How are you going? Dr. Aditi, Dr. Sayeda. Big heart for everyone. Hi, Dr. Saunders. Hi, Dr. Jasmine. Dr. Shama, yes. Dr. Jasmine, yes. Dr. Neshma. Hi, Dr. Bano, how are you going? Dr. Ibrahim. Loud and clear. I'm very happy. Dr. Maria, Dr. Sayed, Dr. Gilan. Thank you. Thank you very much, Dr. Jasmine. I hope you're not tired today, okay? Not tired today? Big heart to Dr. Winnie and Dr. Sharia. Dr. Mariam, Dr. Patel. I'm doing great, Dr. Bavia. Thank you very much. Thank you very much, you guys. Give me please 1 second. Okay, guys. We go and start right now. Our love from Pakistan, love from Sydney. Thank you, Dr. Farouk, very much. Dr. Sepia. Thank you. Okay, guys. Now, today is just fun. The topic is very easy topic. Not hard at all. One of the topic that you can score easily in exam. I believe there is no exam without questions related to this topic. Why? It's basic. It's one of the basic topics that you must know before you go into the exam. Hi, Dr. Ankita, how are you going? Dr. Sana, I have been following for a while. How can I join the course and discount? Look, Dr. Sana, please, in this page, just leave a message, an inbox to the admin, then the admin will help you in this. Okay, please, admin, if you can help Dr. Sana, will be great. Hi, Dr. Sheepa, how are you going? Okay. Guys, do you know, guys, how important this topic? Very important. This topic, guys, very important. Is it really hard to score in it? No. One of the topics that easily you can score all the marks in it without losing even one single mark. I know you may think it's hard, but actually it's not. Now, what exactly you need to know about today's topic? Do you know, guys, by the way, what is today's topic? No, Dr. Jasmine? RBD design? I have already, guys, done a video for you. RPD, I done a video for you. Guys, did you watch my video on our page? Oh, no, really? Thank you, Dr. Neshma. Dr. Neshma mentioned Perio classification, and Dr. Bisha and Dr. Shama say periodontal classification, periodontal stage and grading. Of course, Dr. Magda. Okay, I'm very happy. Yes, so what did I say in the video then, Dr. Neshma? Yes, Perio classification and mocks. Very happy. Please, guys, when you see a video, please have a look at it because I update you with some information, okay? And this information Actually, important information for you. Okay, let's start right now. Ready, guys, to start? Ready? I'm happy now. Let's start. Let's enjoy. Where is the video? Dr. Gilan, the video is on our page, Facebook page. In the same page you attend the session right now. Yes, Dr. Nishma is right. Guys, can you see my screen? Can you see, guys, the lecture? Okay. Why this topic is important? This topic is important because it's one of the basic topics you must know by heart before sitting for ADC exam. Am I, guys, clear about this point? Thank you very much. Dr. Sharma said yes, Dr. Bido. Okay. Great. Let's enjoy it right now. By the way, for all our champions, do you know, guys, when the course will start in? The official course, guys, starts? Any idea? Yes, no? Okay. Guys, the course will start in next week. 30s. No, 30s. 30. No, next week. 30s. I think that will be Monday. Yes, next Monday. No, next month. Next Monday. 30s. Very good, Dr. Sono. You guys know everything. Next week. Very good. Are you guys excited for the course? Look, personally, I'm very excited. Are you excited? Okay, I'm very happy and excited too. Let's start this topic and get a little bit of questions and mock on it. Guys, do you believe in this? Success is not a stroke of luck. It is a journey. Sometimes tough. The journey, sometimes tough. The success, sometimes tough. But never impossible. Yes, success, never impossible. And the journey, never impossible. You need to work hard. And also, working hard not enough. You really need to work smart. You must enjoy the process. As a way that I enjoy it right now, being here between you, even if I'm tired, but still enjoy it. I like it. And remember, what we need to remember, that success is real when you refuse to give up. Guys, do you guys give up at all? Do you guys give up or do you refuse to give up? Agree? Dr. Zahir, I'm very happy. Dr. Tariq, been watching for a while? Okay. How to apply for the course, please, doctor? Just please text the academy and then they will help you. Yes, we need to, yes, refuse to give up. That's a one. Okay, so we shouldn't give up right now. Should we enjoy what we do? And that's what we gotta do right now. No pressure, no stress. Today, just enjoyment. The new system. Do you remember, guys, the old system? Can you give me an example of what we used to diagnose the periodontal diseases on the old system? We used to say, please, guys, help me in this, because I want to remember. We used to say the word chronic. Chronic is what? The progression. Guys, please, guys, just listen to me, because I gotta teach you how to diagnose. If you don't know, if you know, that's okay. How to diagnose the periodontal diseases on the easiest and right way. Before, we used to say chronic, which is the progression of the disease. What else? Could be generalized or localized. What is this? Guys, help me, guys. I don't know. When you say generalized or localized, which part is this? It is distribution. We used to say in the old system, chronic, localized or generalized, and then mild to moderate. Or mild only sometimes, sometimes moderate only, sometimes moderate to severe, or severe only. How we call this, guys? Severity. Who's, guys, helping me? Let me check who's helping me. Who's reminding me? Thank you, Dr. Monish, helping me. Thank you, Dr. Tasmim, helping me. Thank you, Dr. Maria. You mild. Thank you, guys. You're really great. Look, I know, guys, not everyone knows this, okay? So if you don't know, that's okay for now. Back again. So in the old system, we used to say chronic, generalized or localized, mild to moderate, what? If you guys remind me with the last part of our diagnosis on the old system, I will give you $5. I always promise you to do this. If you meet me and remind me with $5, I'll give it to you. What is the last part in the diagnosis? Not many people knows. No one has commented. Means not many people knows. Okay. Let me check here. No severity, no. No, it's not. Localized, no. Gingivitis or periodontitis? Yes, but what sort of periodontitis? I'm very happy, guys. We call it plaque-induced or non-plaque-induced. At least, guys, you're trying. I'm happy you're trying. Okay, so let's write down the whole diagnosis. Chronic or acute, but acute wasn't really used that much for periodontitis. Generalized or localized. Moderate to severe, for example. Plaque or non-plaque induced periodontitis or gingivitis. Now, chronic and acute, it does explain the progression of the condition. Generalized, localized distribution. Moderate to severe is severity. Plaque-induced periodontitis or non-plaque-induced, this is a source, the cause. Gingivitis or periodontitis, the difference between both is periodontitis, you must have pocket depth. Gingivitis, you don't have true pocket depth. Is it, guys, clear so far? What I try to explain to you, because I'm gonna shift this straight away to the new system. And at the end, we're gonna have good mock, right? And this mock, guys, are gonna help you to understand and test yourself if you really will be able to answer this question, and definitely will be able to answer the question exam as well. Clear now, guys, so far? Clear. Let's shift this into the new system. How? Easy. Acute and chronic. We're going to replace it with what? With grading. Like grade A, grade B, grade C. A means just start to grow slowly. Grade B means moderately progressing. Grade C is what? Is rapidly progressing. So the word acute or chronic has been replaced by the grading. Grade A, grade B, grade C. No, now we don't have any more chronic. We don't have any more acute. Is that, guys, clear so far? Let me check here. Why I only see my video? I don't see the session, the class. It's here now. I can see the session. Very good. By the way, guys, we're gonna have a big mock mainly for this topic. Okay, great then. Second point, generalized and localized is still existing in the new system. And this somehow related to staging part, but indirectly. Like in the table, it will be related to staging, but not directly. What about moderate to severe? We mentioned it is severity. Severity. We replaced it with what? We replaced the severity with staging. With staging. So now severity with staging. How many stages? Stage 1, stage 2, stage 3, stage 4. A stage 1 means just mild periodontitis, like this one, mild. Stage 2, moderate. Stage 3, severe. Stage 4, very severe, potentially severe. Guys, is it clear so far? Easy right now? Did you know, guys, how they changed the old system to the new system? This is what exactly they have done. Very good. What about periodontitis or gingivitis? Gingivitis, again, we mentioned, not existing in the new system. They removed it. We don't have gingivitis anymore in the grading and staging system. It has its own different system right now. So now they said this system about staging and grading only related to periodontitis. Guys, this is very, very, very important in exam. So now, do you think the new classification system for gingivitis and periodontitis, or only for periodontitis? This point is very, very, very important for exam. Because they're going to give you a photo, they may give you a photo of gingivitis, and then they ask you, diagnosis here. And then, definitely, you may choose staging and graded system, which is not. Okay, so now, is it clear so far, guys? Can I move on? Can I move on? Okay. Let's move on then. By the way, the good thing about the new system, it's really very easy system to explain to the patient in the clinic, to communicate, even to communicate with the specialist as well. It allows accurate diagnosis and prognosis, supports effective patient education and easy communication, and then it does ensure appropriate treatment planning. And it does fix the previous classification issues. Yes, we had lots of issues in previous classification for more than 20 years. As we mentioned before, based on staging and the grading. Okay, now, guys, you must understand this table, not to make it up, to understand this table by heart. Okay, guys? Exactly to you right now. You must understand this table by heart, not to make up this table, but to understand it. Now, the table mainly for severity. So now, guys, we're going to discuss the severity first, or staging first. After staging, we're going to discuss the grading, and then we'll have a mock at the end. Staging. Staging mainly for severity. Does it work for complexity? Yes. What does it mean? The difference between severity and complexity, guys. Guys, what's the difference between severity and the complexity, guys? Why severity is important and the complexity is important? Let's make it easy to you. Based on severity, you will decide on one, who's going to the treatment, who is going to do the treatment. Is it me as a general dentist or a specialist? So now, if you're going to get question exam in this part and tells you what is the diagnosis here, and you choose diagnosis as stage 4, straight away means you need to refer the patient to specialist. Easy concept. So the importance of severity is to decide, should you treat the patient by yourself or should you refer the patient to specialist? Great. Let's now look at about the complexity. What is the importance for complexity? If you guys say it, I will be very happy. What is the importance of complexity? Why it's important to know the complexity? Let me check. No one has answered. Only specialist, severity. How much? Complexity shows how difficult. Very good. I love it. Complexity shows how difficult the treatment will be. Treatment plan, prognosis. Guys, please, guys, everyone love this. Everyone, guys, like Dr. Akriti. No progression, Dr. Akriti, is diagnosis. Prognosis, no progression. Progression, we mentioned for grading. I just mentioned this right now. But but I give you how to know Dr. Akriti, because you know how much I respect you. Prognosis, Dr. Munish mentioned. Treatment outcome, Dr. Tasmim. Amazing, Dr. Joyne prognosis. Very good, guys. So we're looking for Dr. Marais prognosis. We're looking for prognosis. Now, let's again simplify this again. 1. Severity. To know, should I treat the condition or not? If you're going to get question exam or you work as a dentist, you need to know. Complexity. You discuss with the patient the outcomes. It's a really complex, complicated case. Oh no, just the easy case. The outcome is very predictable. Easy case to manage, not hard at all. This is complexity. Now, from here, we can understand severity, complexity, and extent and distribution. As I told you, the same things. Extent and distribution. We say localized if less than 30% of these involved with periodontal diseases. Generalized when more than 30% of these involved in periodontitis. Severity. What factors it does affect the severity? 3 things mainly. 1 is interdental care, which is interdental clinical attachment loss. The second is radiographic bone loss. How much bone loss we have on the tooth. The third, the tooth loss due to periodontitis. So now, guys, how many factors? If we're talking about severity as a part of staging, how many factors, guys, I need to think about? 3 factors. The first factor is scale. The second factor is radiographic bone loss, means you must look at the X-ray. The third one, the tooth loss. The tooth loss. How many teeth has been lost? 3 teeth has been lost. 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 3 teeth has been lo Is it guys clear so far? Let's take everyone individually. Cal, clinical attachment loss. Yesterday, day before, on Monday session, not Tuesday, we have explained the dental chart. Guys, you can find it. If Facebook hasn't removed it, this class, you can find it on this page, the page you are watching the video right now. If you scroll down, you will find this lecture. I explained the chart. I explained every single factor on the chart, and I calculated Cal. So guys, please go back again to know how to calculate Cal. Now, stage 1, incipient periodontitis. What does it mean? Guys, can you guys count for me? Say this to me. 1, 2, 3, 4, 5, more than 5. Guys, can these guys write down this for me? Write down 1, 2, and take breathe. 3, 4, take breathe. 5, take breathe. More than 5. Okay? Let me guys see, guys. Did you write down or not? Let me check on you. No, I haven't, guys. No one, guys, wrote down. Except only 2, 3, 4. Okay. Now I can see. Please, admin, please, if you can, admin, just please reply this candidate, please ask him for the course, okay? Because I believe now they will ask it, so please reply them. Now, yes, Dr. Sayeda, 1, 2, 3, 4, 5, more than 5. Very good. 1, 2, 3, 4, 5, more than 5. This is, guys, the easy way to remember the clinical attachment loss for every single stage. Write in my book, Big Heart. Now, what if it's 1, 2, stage 1, 3, 4, stage 2, 5 or more than 5, stage 3, 5 or more than 5, stage 4? Easy now, guys. I think you shouldn't forget this part at all. Easy now, guys. Okay. Let's, guys, please write down this for me. 15. Make it double. 30. Then make it treble. Din, din, din. That will be like 30, 60. And then make it 90. 60. Let's just make it right. 30, 15, 30. Make it 30 to 50. 50 to 100. What is this? Please, guys, write down this for me, guys, again. Let's make it this way. 15, 30, 30 to 50, 50 to 100. What is this, guys? This is this. Radiographic bone loss. When you look at the radiograph, he found it less than 15%, means stage 1. and then 30%, like 1/3 of the bone has been eaten away, main stage 2. Until the midroot, just until the midroot, stage 3. Midroot all the way down to the apex, stage 4. If you go and check ADC handbook for a released question, they give you X-ray, and then they give you, you know what? Ask ChatGPT the same question. Will answer it wrong. I have asked many candidates this question before and they answer it wrong. You know why? Because they give you X-ray, and the X-ray, they show you the bone at this level, and then they give you everything else, stage 1 or stage 2 or stage 3, and then everyone can choose only stage 3, but no one has looked at the X-ray to find out the amount of bone resorption with all the way down. Guys, am I clear about this? Guys, am I clear? Is it easy so far? Thank you, Dr. Naindani. Big heart to you. Okay, guys, can you guys count this for me again? Okay, that is great then. Guys, is that clear? Should I repeat again? Tell me. I will be very happy, guys, to repeat again. Tell me. Guys, if clear, say clear. Repeat, I will repeat. Say clear or repeat. Repeat once, Dr. Bid. Okay, Dr. Sham. I know you write down in your book. Make it easy now for you. Believe me, guys, if you understand the things, ADC will be fun for you. All ADC exam around this type of knowledge, by the way. Now, we are talking about staging. We have 4 stages. Stage 1, stage 2, stage 3, stage 4. A staging mainly for severity and also for complexity. Distribution already made them. Severity. In severity, we have how many factors, guys? 3 factors. I'm closing my eyes right now, and I'm saying them while I'm closing my eyes. Believe me, guys, I close my eyes, okay? The first one is interdental cal, which is clinical attachment loss. The second factor is radiographic bone loss. The third factor, guys, I'm not reading, okay? I'm just closing my eyes. The third one is the number of the tooth lost. How many number they are? They are based on the periodontal diseases. Like periodontal diseases has affected teeth to be lost. Okay, how can I memorize this easy concept? For endodental caries, you just need to count 1, 2 as a small baby. Take a breath. 3, 4. Take a breath. 5 more than 5. 1, 2, stage 1. 3, 4, stage 2. 5, more than 5, stage 3 and stage 4. Now, radiographic bone loss. Look at the X-ray. See how many bone loss around the tooth has been lost. How much radiographic bone. Look at the X-ray and then see how much bone has been lost around the tooth. Now, say this, 15%, 30%, 30 to 50% or 50%, and then more than 50%. If it's just 15%, we are now talking about stage 1. If it is just 30%, not more than this, between 15 and 30%, means now we're talking about stage 2. If it is up to 50%, stage 3. More than 50%, the mid of the root, now it's stage 4. Is that guys clear so far? Let me check, guys, your comments. Let me, guys, check your comments, because the second point even will be much easier. Believe me. Chris, clear? Chris, clear. 3 factors, yes. Clear, doctor, clear, doctor. Clear, doctor, clear, doctor. Clear, clear. Okay, very good. I'm happy now. Very clear. Take care. No, this actually, thank you. The third point, the easiest point. Can you please, guys, give me a trick for the third point? Remember it? Guys, can you see, guys, give me a trick for the third point? Remember it. Do you know what's the trick? Number 4. So, guys, what's, guys, the trick for the number of the teeth lost? Number 4. Why? Let's check this. Number 4. If you have no tooth at all lost, at all, because of Perio disease, you are stage 1 or stage 2. If you have 4 teeth or less, like 1, 2, 3, 4 teeth lost, you are in stage 3. If you have more than 4, like 5 and more, you are now stage 5. Clear now, guys, about this? Easy so far? So the third point, which is a tooth loss, depends how many teeth has been lost or how many teeth will be lost. Teeth in the past has been extracted, or the teeth will be extracted in the future. Both of them will be counted here. Not just only the lost. You know what? They need to fix this. These people, they need to fix it. Because even the teeth you're gonna extract in the future, based on the mobility and attachment loss and all the stuff and bone around them, still can change your staging. 4 teeth. No teeth, stage 1, stage 2. 4 teeth or less, stage 3. More than 4 teeth, stage 4. Now, I hope, guys, it's clear for severity. Let's take an example right now quickly. Now, look at this. The first one is Cal. Do you think, guys, Cal, in this case, can be, let's look, guys, at the book and stuff, just to make it easy for you, because I don't want you to calculate everything from the X-ray. Guys, would you like, guys, to calculate everything from X-ray? Do you want to make, guys, challenging for yourself? Guys, do you want to, guys, make it challenging for yourself, guys? Do you want to calculate everything from X-ray? Because believe me, go and check this from the handbook, from the release the question. The answer of the question was only provided in X-ray. Only X-ray. The other information, the scenario, I don't think even was related to the answer. Okay? Let's now look at the X-ray. Okay, guys, this guy's the X-ray. Give me this a photo of the X-ray. Can you give me now the stage in here? Is a stage 1, given that's only 1 tooth extracted, not many than 1 tooth. Okay? Which stays in? This tooth, I think, extracted because of, yeah. I'm not sure this is successful Perio or not. But I can forget about the tooth now. Just give me based on attachment loss, bone resorption, not the amount of the teeth. Because the tooth may be extracted for any other reason, by the way. That could be, I have no information about the tooth, so consider it's not existed. Guys, which stage is this? Let me check your right answer. I see some of you stage 2, and other of you guys say stage 1. Why? Give me explanation. Apply 2 things: the amount of bone resorbed to the roots, and also okay. Look, guys, that's a cement enamel junction. You know, guys, why I'm giving this example? I'm giving this example because this is how you calculate in exam. So means that's all the roots. Now, let's say where exactly the half of the root. Let's change the color to orange. This is half of the root. Am I right? Even you need to be a little bit more down. Means this is 1/3. A bit more down to be 1/3. 1/3, that's, guys, the shortest root, by the way. I'm calculating from the shortest. And this is 2/3. 1/3. 2/3, 3/3. Like, even that's, to be fair, this one gave a little bit up. Now, do you think the amount of bone resorption has happened, which is this part only? Do you think this is 15% or more than 15%? Like 15, 15, 15, 15, 15, 15, 15. That's more than 100 now. What do you think, guys? Let me check your answer. Less than 15%. I'm very happy. Less than 15%. I'm very happy. Less than 15%. I'm very happy. Because the bone has ended until here. That's the bone level. Look at this. So this part is just less than 15%. So which stage, guys? If less than 15%, how much can? 1-2 millimeter only. No more than this. Let's check the answer. So you see stage what, guys? If your answer is stage 1, be very happy because you did the right thing. And if your answer is stage 2, you've been very close. Okay, that's really very good. How we decide in grading? Dr. Aditi, that's what we're going to explain shortly. Okay, I'm going, guys, very slowly. I just explain things in details, right? Because Dr. Stage 2, you are between 15% to 33% or 30%, which is not here. The amount of bone resorption, not yet more than 15%. Yes, Dr. Praveen, yes. Yes, okay. Guys, can I move on right now, guys? Okay. Complexity. Which factors going to make the treatment hard and complex? One, the most important thing is propane. Make it easy to you. 4 millimeter. Guys say 4, 5, 6 millimeter. 4, 5, 6. 4 mild, which is stage 1. 5 moderate, which is stage 2. 6 a severe, which is stage 3 or stage 4. Guys, can you please guys give me the numbers again? For pocket, guys, for complexity pocket, what are the numbers we're gonna use? 4, 5, and 6. 4 means mild. 5 mean moderate. 6 means severe, very severe. Mild means stage 1, stage 2, stage 3, stage 4. Easy? Easy peasy. This is the most important thing, which is the pocket depth. What else? The most second important part is the bone loss. What exactly in the bone loss? The pattern. Is it horizontal or vertical? Horizontal bone loss is stage 1 and stage 2. But vertical bone loss, stage 3. Severe bone loss, as we mentioned here before, is stage 4. Again, now we're looking at the pattern of the bone loss first. Horizontal bone loss, stage 1, stage 2. Vertical bone loss, stage 3. Now, let's think about the second one, the severity of the bone loss. Okay. Moderate ridge defects, moderate, just moderate ridge defects, which is like moderate bone resorption, which is up to the middle of the root, mid-third of the root, right? In this case, it's stage 3. And just a logic. If you have, guys, okay, please, guys, every one of you guys say this to me. Say, please, guys, dentistry is fun. Please, guys, say dentistry is fun and the logic. If you say this, it means you really, 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 really enjoy what you do, enjoy being a dentist, and you deserve to be a dentist. If you say this, because I'm gonna show you how it is. I'm gonna show you how love is dentistry, guys. Yes, I love this. Big heart to you, doctor. Dr. Sayeda. Big heart. Big heart, Dr. Nesh. I'm gonna show you how fun it is. Big heart to you, doctor. Dr. Magda and Dr. Shreya. And Dr. Rami. Now, and Dr. Natal, and Dr. Maria. Now, how is this? Easy. You don't need to mug up anything or to memorize anything. Do you remember we mentioned in severity, the bone will be extending to mid third of the root, like 50% of the root? Think about it. If the bone resorption around the molar up to mid third of the root of the molar, do you think the furcation involvement, where about it gonna be? Do you think it's gonna be just a mild if you have bone resorption under the mid root? Or it should be between class 3, class 2? What do you think if you have root resorption in a molar to the mid root until the middle of the root? Do you think the furcation involvement will be happening or not? Will be happening. Now the ridge defect, where about gonna be, guys, the ridge defect? Just a moderate ridge defect. Look at this. That's exactly what's happening. So now, do you really need to memorize these 2 points? Not really. I don't need. Why? Because it's given already here. Extending to middle third of the root. It's just a logic. If you have a bone resorption in a molar until the mid root, definitely you will find furcation involvement. And this furcation involvement will be class 2 or class 3. Easy now, guys? And moderate retrosorption will be happening. Okay. Look at this. Look, guys, in this tooth. Can you tell me which stage is this, guys? Look at the furcation involved. Look, guys, at the bone resorption. Which stage, guys, if you see this bone resorption here? Guys, the furcation involvement or not here? Thank you, Dr. Neshma. Big heart to you. Stage 3. Thank you, Dr. Sayeda. Guys, easy now, right? Easy now, right, guys? Is it hard? No hard. The amount of bone, do you think, guys, that's severe bone? Do you think this is severe bone or just a moderate bone defect, a ridge defect, moderate ridge defect? Thank you, Dr. Akriti. Big heart to you, Dr. Akriti. It is. It is stage 3. Easy now, guys? Easy PC. And the answer? If you go and check the answer, guys, it's stage 3. Perfect. Now, stage 4. Stage 4, the bone resorption is going to be too much. Middle third of the root and the beyond. Middle third to beyond, like middle third, 2/3 of the bone has been removed until the root at the apex. Now stage 4. Think about it. Think about it. If you have, you know what? You tell me. I'm gonna put it here right now. If you have a tooth like this, that's very weak tooth. Guys, I know, guys, I'm very good in drawing, guys. No, that's not a tooth anymore. I'm, guys, the worst in drawing. Okay? If there's a tooth right now, and you have the bone level until here only, I will give you some factors. You tell me, this amount of the bone, more than 50% or not? Yes, stage 4. If the bone is more than 50%, like I think that is about 85% of the bone is gone. Now, can you tell me about the ridge defect? Is this a severe or moderate ridge defect? Severe ridge defect. Now, do you think this tooth will be mobile or not? Yes, mobile. Which grade? Either 1, either 2, or 3. Either 2 or 3. Now, do you think this tooth will be standing nicely like this? Or the tooth will be tilted? Tilted like this? Any side will be tilted? Will be tilted. Do you think a patient by this teeth, do you think he will have multiple teeth? I don't think so. He may have only 10 teeth in the top, max, and 10 teeth in the bottom. Do you think patient with this type of teeth, and he has less than 10 teeth on the top, 10 teeth on the bottom, will be the bite collapsed or not? Yes, the bite will be collapsed. Like the bite will be small bite, no big bite. Let's decide on this. Only we know by one thing, the amount of bone resorption. That's exactly what's happening here. 1. Tooth mobility, more than 2, like 2 and 3. Easy. How do I know it? Remember this. Oh, 1 second, please. Remember this. Ah, 1 second, guys. What I'm sharing right now. This one down. Let me look at here, PowerPoint. Yeah, that's a PowerPoint, yes. Okay. So now, always remember with this example, a tooth has just a little bit of bone here. 1. Let me just put this one up. Guys, can you see, guys, my drawing, guys, and everything? Because I feel like I draw on the screen, not in the slides itself. Let me just reshare again to be sure I'm sharing the right thing. Yeah, I share the right thing, yes. Okay, that's amount of bone. Now, the first factor, make it easy. Mobility. Definitely will be grade 2, grade 3 mobility. Ridge defect, definitely that's a ridge level, will be severe ridge defect. And then the tooth will be drifting, tilted, flaring. Bite will be collapsed. And then this patient definitely will have less than 20 teeth, 10 on the top, 10 on the bottom. That's it. Easy now, guys, the staging, guys. Any problem now with the staging? Can we move now, guys, the grading? Grading even much easier. After this, guys, we're gonna go with the mock. Guys, is that clear? Because guys, if it's clear, guys, let me know it's clear. You know what? Before even guys will go ahead, let's summarize all of this. Guys, would you like guys summarize all of this? Yes, guys, it's summarize. Clear, summarize. Let's check, guys, your answer in the mock. Guys, should I summarize or not? But please, guys, every one of you guys write down. Summarize, okay, Dr. Aditi, I will. Dr. Yamuna, clear. Only Dr. guys Yamuna, only Dr. Aditi wanna me summarizing? Yes, please, okay, I will do. Yes, doctor, okay. Now, the first one, in severity. Which number, guys? Which number? Dr. Ibrahim is very excited for the mock right now. Wait, we still have grading. Mock will be staged and grade on the stuff. Oh, Dr. Ramin, please, guys, give big out to Dr. Ramin. She has a baby. Okay, now, one, but please, guys, everyone can write down with me, okay? Severity. And severity or staging, how many guys staging guys we have? 4 stages. 1, like stage 1, stage 2, stage 3, and stage 4. What is the importance of staging? It's gonna show me 3 things. 1, or actually main things, and then sub title after this. The most important is severity and complexity. And the third is distribution. 1, severity. How many factors, guys, we need to determine the severity? Guys, how many factors we need to determine the severity? 3 factors. What is the first factor? Big heart to you, Dr. Nandini. What is the first factor? Is clinical attachment loss. How do you know it? We need to count 1/2 or 1-2, then 3-4, then 5, more than 5. What are, guys, the numbers? 1, 2, 3, 4, 5, more than 5. Now, 1, 2 millimeter, stage 1. 3, 4 millimeter, stage 2. 5, more than 5, stage 3, stage 4. Clear, guys, to everyone right now? Perfect. What is the second factor? The factor is the bone loss, the radiographic. You must look at the X-ray. Radiographic bone loss to the length of the root. How much from the length of the root? Guys, what, guys, are the number for radiographic bone loss? What, guys, are the numbers? The numbers are 15, 30, 50, more than 50. 15, 30, 50, more than 50. Less than 15% of the root. Bone resorption, the bone loss at less than 15 of the root. In this case, will be stage 1. Less than 30, like between 15 to 30. Stage 2. Between 30 to 50. Stage 3. More than 50. Stage 4. Clear now, guys? Never, guys, forget this anymore. And then the number of teeth. We have 0 teeth. The secret number is 4. 4 means Stage 3. Less than 4, like 1, 2, 1, 2, 3, 4. Stage 3. More than 4. Stage 4. No teeth extracted, like 0, because of Perio diseases. Stage 1 and stage 2. Clear, guys, so far? I'm very happy and proud of you. Now, what about complexity? What is the most single 3 factors? What are, not what is. I will make it 3. Before I was thinking only about pocket depth. Now I'm going to make it 3 factors. What are the most important 3 factors will make you easily decide on complexity? Decide on complexity. Wow, Dr. Maria, big heart. Big heart, Dr. Maria. Guys, Dr. Maria, guys, made everything for you guys. Please, guys, before we move ahead to complexity, give big heart, Dr. Maria, guys. What are, guys, are the 3 main? Thank you very much. Dr. Bharati, you very close. Pocket depth, pattern of bone loss, and severity of the bone loss. Pocket depth, Dr. Nandani, pocket depth, severity, no, pattern and severity. Okay, guys? Please, guys, write down this for me. Write down, because in severity or the amount of bone loss, I will decide on furcation, I will decide on mobility, I will decide on tilting teeth, the rigid effects, furcation, all the stuff. Please, guys, fix this for me. Make it pocket depth, pattern of bone loss, and amount or severity of bone loss. Please, guys, fix this to me. Prop in depth, furcation involvement, horizontal, vertical. Okay. Thank you, Dr. Nandini. She fixed this for me. Pocket depth, pattern of bone loss. I love. Please, guys, everyone give big heart to Dr. Nandini. Nandini. And Dr. Irina as well. Why? Because based on this, I want to give you big heart, but it doesn't move. It's very fast. Candidates writing very fast. Why? Because pocket depth, we go with which number, guys, in pocket depth? Which number? Which number, guys, in pocket depth? 4, 5, 6. Thank you, Dr. Shama. 4, 5, 6. 4, stage 1. 5, stage 2. 6, stage 3, and stage 4. Easy? Now, let's look at the pattern of bone loss, like this one, pattern of bone loss. What are the 2 patterns? We have horizontal bone loss and vertical bone loss. Horizontal bone loss will be stage 1 and stage 2. Vertical bone loss will be stage 3. Clear, guys, so far? Clear, guys, so far? Dr. Ankit and everyone, I'm very happy. Horizontal bone loss will be stage 1, stage 2. Vertical, stage 3. Very good. Let's now think about the amount of bone loss, the severity or amount of severity of bone loss. What does it mean? If you have a moderate, if you have up to half of the root only, just half of the root, you will end up with something with furcation involvement 2 and 3. And you will have moderate ridge defect. Okay? Okay. Now, what if it's severe? What, guys, if it's severe? Right? In this case, what are you going to get? You will find severe ridge defects, and the mobility will be severe as well. Mobility 2 and 3, like the tooth need to be extracted, stage 4. And you will find that it's tilted, bite collapsed, and you will find trauma, because every time the patient bites, tooth is very loose, crepitus, and the number of the teeth mostly will be less than 20, 10 the top, 10 the bottom. Guys, is that, guys, easy or hard? Please, guys, I need your genuine feedback about this part. How it is? How, guys, dentistry it is? Is it really hard? Easy? I'm very happy. Big heart to this. Big heart. Easy? Big heart. Thank you, Dr. Siba, for yourself, definitely. Thank you for yourself. Not hard, right? Very good. Easy, you made it fun. And the logic, Dr. Bido. I'm very happy to hear this from you, Dr. Amin. It's easy, you need to revise. I need to revise. Definitely, Dr. Edity, you must revise. Fun and logic. I'm very happy about this. Dr. Yamuna, I want to clarify whether I got it correct. Whether stagial replaces generalized and localized. No, it doesn't. It just separate things. That's why I said don't care about generalized and localized in the staging part. Okay, it's just subcategory. Yes, Dr. Bido, you made it easy. I'm very happy, guys. See you happy, guys. Dr. Mahnur. I like your name, by the way, Dr. Mahnur. Okay. You know what? Let's now move to grading with all love and happiness with dentistry. Okay. Grading much more easier than staging. Only 1 point. Only 1 point need to be clarified. The rest is easy. 2 points, to be honest to you. Only 2 points in grading need to be just simplified. The rest will be easy. And then we can answer the mock straight away. And then any question regarding this part in EDC exam, you will be like a boss, answers question correct. Without stress, you keep laughing, smiling, you remember the session. Okay, now, guys, by the way, I'm just going to go through this quickly, just again if someone has joined right now. Staging shows severity and consider how complex is a treatment. We discussed this. Please, guys, I need you to know this by heart, this part. Especially only these two. Forget about, we already mentioned this, This one, stage 3. Periodontitis with potential for additional tooth loss. Like, it gonna be only 1 tooth, 2 teeth, 3 teeth, 4 teeth, but not 5. Stage 5, stage 4, advanced periodontitis with extensive tooth loss and the potential loss of dentation. What does it mean? You may end up with extracting all the teeth. More than 5 teeth, like 5, 6, 7, above 5. This one, less than 5 teeth to be extracted. This one, 5 or more than 5. I hope now it's clear to you. That's all I need from you. By the way, what I will do right now is, just for you if you want to revise, after we finish the class, you can have a look at have a look at this one. Because whatever I explained is here now. This one for stage 1. This for stage 2. Whatever I explained is here. This is stage 3. This is stage 4. This is stage 4. Now grading. In grading, as we mentioned, guys, grading guys for what? Let me see, guys, if you're asleep or awake. Grading guys for what? Grading 4. Thank you, Dr. Sandra. I'm happy now, guys. You are awake. Thank you, Dr. Sanders, Dr. Akriti. You got it right this time, Dr. Akriti. I know maybe last time it was typo mistake. Progression. Look at it. Grading is or shows how fast is the disease progressing, or how fast the disease is progressing, and to consider risk factors like modifiers, like smoking and diabetes. Now, let's look at this table here. We have grade A, grade B, and grade C. Grade A slow, grade B moderate, grade C rapid or fast destruction has happened. We need to know them. What are the factors? We have risk factors, we call it modifiers, and we have direct evidence and indirect evidence. The part really I want to explain is this part. The direct evidence, I want to explain it to you because it's not hard, but it needs only 1 minute explanation. And then the bone loss age. We like the direct evidence. What does it mean by the direct evidence? Direct evidence means I have a patient. It's my patient, all the patient in the practice. This patient, I know him in the last 5 years. In the last 5 years, at least I know this patient. And then I got done X-ray for him 5 years ago, and X-ray today. So now, guys, what's the difference between these two X-rays? How many years? One X-ray done 5 years. No screen, sorry. Can you see right now? So what I was saying is, grading shows how fast the disease is progressing and consider risk factors like diabetes. And then we mentioned we have mainly 3 factors: direct evidence, indirect evidence, and risk factors. Then I was explaining to you, drawn here, the direct evidence, what we call it as radiographic bone loss or CAL. Now, let's say if I have X-ray or a chart. Patient, I got X-ray 5 years ago. Another X-ray today. How many years, guys, difference between these two X-rays or the chart? 5 years. Thank you very much. 5 years. Now, you check the bone level in 5 years. Get the old X-ray. Let's say this is my tooth, my X-ray in 2020. The bone level was until here. 2020. In 2026, the bone level until here. Do you think the bone level right now, there is a loss has happened on or not? Do you think, guys, there's a loss happened or not? Yes, loss happened. So it's not grade A. Do you think the loss more than 2 millimeter or less than 2 millimeter? Look at them. That's all amount of bone loss from this level to this level. More than 2 millimeter. Now we talk about grade C. Clean now, guys, this one. Okay. So you should have an old X-ray, 5 years old, and a new X-ray done today or maybe last week or anytime. And then you check the bone loss in the last 5 years. Okay. At any time, by the way, guys, in the 5 years, but you need to know the baseline X-ray in 5 years. Now, the second one, I want to really explain to you, bone, the percentage between the bone loss age of the patient. How is this? Now, let's say patient age is 20-year-old. Because, guys, what we're going to do is bone loss on the patient age. Now, percentage of the bone loss divided by patient age. Do you remember, guys? Do you remember in stage 1 how much, guys, bone loss? How much percentage? Less than 15%. Let's say 10%. And the patient age is 20-year-old. Can please, guys, calculate this for me? 10% on 20-year-old. How much, guys, this? That should be 0.5, right? It should be 0.5, like here. So now this patient is grade B. Guys, is this guy's example is clear right now? 0.5. So it's grade B. Okay, now, guys, this example? Let's now give another example. Guys, do you want, guys, another example? Let's do another example. Let's say severe bone, a grade stage 4. Stage 4. Stage 4, like 70% bone loss, because we said 50 and above means like 70%. Now, 70% bone loss. Guys, give me, guys, patient age. Any patient age. Let's say 50-year-old. 50-year-old, of 55. Can please, guys, calculate 70 divided by 55? How much, guys, please? 70 divided by 55? Okay, guys, please, guys, divide 70 by 55. 1.2. Woo. 1.2. That's too much. Now, guys, now you tell me which grade this? Which grade? We said more than one. Look at this. More than one. Grade C. Fun, right? Just fun. More than one. Grade C. Another example, guys. Now, less than 25. Grade A. Between 25% to 1. Grade B. More than one. Grade C. Another example, guys. Let me check. If another example, say yes. Yes, Dr. Neshma now is happy. It's a good game, Dr. Neshma, right? This is the only two things you need to remember about grading. No more, because the rest is too easy. As example, Dr. Aditi, another example. Okay. Look at this. Let's say stage 3. Stage 3, the bone loss is about 30 to 50. Let's choose 40. 40% bone loss between 30 to 50. And then the patient age is, let's say, the same patient. To understand the example, 55. Same patient. He doesn't have 70. Has only 40%. And it was stage 3, not stage 4. Definitely now the grading will change. That will be definitely between less than 1 and more than 0.25. Please, guys, calculation. 40% bone loss on 55. 0.7, very good. Which grade? Grade B. Easy peasy, guys. Not hard, right? Not hard at all. Very good. Grade B. Happy. Now, let's move on to the easiest part. Whatever coming right now, just easy. Now, the case phenotype, what does it mean? How much plaque and calculus do you have? If you have heavy deposits like too much plaque and calculus and just a little bit of bone resorption, grade A. If you have a moderate plaque and calculus but not too much and a little bit of bone resorption, that's a grade B. If you have severe bone resorption, like more than 50%, 60%, because the guy's severe more than 50%, 50%, 70%, and just tiny and even not existent at all plaque and calculus, now we're talking about rapidly progressive or early onset diseases. Means there's a family factor is involved here. Positive family history. Maybe patients too much smoker. Maybe patient on uncontrolled diabetes. There are systemic factors has been involved and exaggerated the bacteria inside the plaque. Why? Because plaque, it's just mine, tiny, not very much. Smoking and diabetes. Non-smoker, grade A. Smokes less than 10 cigarettes, grade B. 10 cigarettes or more, grade C. Patient has no diabetes, grade A. Patient has controlled diabetes, grade B. Patient has uncontrolled diabetes, grade C. Oh, modifiers. Easy now, guys. I'll keep this to you if you want to read it after the lecture. Okay? Guys, ready for the mock? Guys, ready for the mock? Dr. Tanvir asked question, how much a cigarette contain one packet of smoking? 20 cigarettes. Okay. Let's answer the mock. Guys, before we start with the mock. Did you enjoy the session? Guys, did you enjoy it? Do you really find it easy or hard? Dr. Amin, Doctor, yesterday you asked in the case discussion, which is more detrimental or worse of a patient smoke with diabetes? Diabetes, doctor. She answered right, correct. Otherwise, I should have told her that's not right answer. Easy, guys? Very good. Yes, it was amazing. I'm very happy, guys. As long as you don't find it hard, you really enjoy it, I'm happy. Yes? You love the session? Very good. Yes, doctor, very good. Very helpful, very good, guys. I'm very happy, guys, for you. I'm very happy. Yes, very much. I'm very happy, guys. Informed, very happy. Although I joined late, but thoroughly loved your way for teaching of teaching. Thank you very much, Tanvi. And I like to see you always successful and happy and things easy for you. Okay, guys, let's start right now. Now, easy peasy. Which guys stage is this? Look, radiographic bone loss less than 15%. Cal just 1, 2. Biofilm heavy. We said heavy biofilm, more into grade A or B, like slight to heavy grade stuff. Moderate rate of progression. No smoker, no diabetes. Moderate rate of progression. Moderate. Which guys, grade guys is moderate? Stage 1, grade moderate. Moderate, Dr. Nishma. We said slow, and then moderate, and then rapid. Not rabbit, rabbit. Okay, guys, rabbit, not rabbit. Like not bunny, okay? Yes, stage 1, grade B. Let's check the answer. You perfect, guys. Very smart. Stage 1, grade B. Let's go with harder case. Now, pocket equal to 5. Equal to 5. We said 4, 5. Remember this. 4, 5. 4, stage 1. 5, stage 2. We said 30%, between 15 to 30%. Remember this, 15, 30%. Stage 2 until now. Cal, you remember 1, 2, 3, 4. 3, 4. Stage 2. Pyfm site heavy, notice lost. Very good. Stage 2 so far. Moderate, again. But he smokes, is that more or less than 10 cigarettes? Diabetic, controlled. Guys, HbA1c less than 7 means controlled. Which stage, which grade? Stage 2, grade B. Smart. Very smart. You remember pocket depth? 4, 5, 6. 6 is what? Can be stage 3, stage 4. Horizontal pattern. The pattern. We said horizontal as stage 1, stage 2, but we already mentioned stage 3 because of this. Vertical, stage 3. Cal, 1, 2, 3, 4, 5 more than 5, stage 3. 2 sloths, less than 4. Still, more than 4, stage 4, but still stage 3, because less than equal 4, less than 4. Heavy, moderate, class 2, again, that's stage 3. Less, 7. Okay, answer, guys. Stage 3, grade B. Very good. That's okay, Dr. Aditi. I know it's typo. Very good. Let's check the answer. Very smart. Stage 3, grade B. Now, periodontal pocket depth, 6, 4, 5, 6. Now stage 3 or stage 4? Stage 3 or stage 4? Ah, horizontal. Bone loss more than 50%. Oh, now stage 4. Vertical, still stage 4. Cal, stage 3 or 4. Like vertical means stage 3, but anyway, we already have stage 4 because of this. 2 slows, the 2 touch more than 5, stage 4. Forcation class 2, 3, stage 3, but we already have stage 4. Uh-oh. No, please. How come? Sorry, guys, don't know what's happened to my laptop. I think we'll be charging then or something. It's white now, but I think it will be fine soon. What I can do is I can delete this, close this one. Okay, guys. Guys, if you see now white screen, I think my laptop got tired from me. And it may take a little bit of rest. Let me do something here to not drop the session. The session will not be dropped anyway because okay, guys. Look, if you can hear me, I'm still on here, but my laptop I think got tired from me because I don't give a break to my laptop. It just got white screen now. Hopefully nothing serious. Guys, can you guys hear me? Guys, can you guys hear me? I don't know what's happened to my. You know what? I may stop sharing. Maybe that can fix the issue. And then get my PowerPoint again. Guys, I'm very happy, guys, that you learned something new today. Okay, guys. Okay, I'm getting now, guys. Things fixed again. Okay, okay, guys. I'm sharing the screen now again, guys. Okay, view. Reading view. Was this question? I think that's a question now. Yep, that's the one. There, guys. Can see, guys, my screen again? Let me, guys, check yours, guys, here. If you guys check what you see now on the Facebook. Seems like that it doesn't actually show. It's still like loading around. No, I think now we'll be okay. I don't know why it's still loading for me. So Stanvir, sir, I'm anxiously waiting for your prosdonic series lecture, especially your RBD design lecture. Yes, Stanvir, that will be mostly this week or next week max. If you want to, we can make it tomorrow. If you want to have the RPD design, we can make it tomorrow. We still like in we don't GGK some do the stuff. Why is it not showing? That's very weird. Dr. Bidu, are you going to take classes once the course starts? Who else, Dr. Shiba, will take classes? It's me taking classes every night. I have no break, even when I have, if I go overseas as well, I'm the one taking classes. Dr. MV, guys, why is it not showing? I am big die-hard fan of you, brilliant prosthetics. Concept love every bit of it. Thank you, Dr. Tanvir. Okay, guys, let me check why. Share again. I think Zoom itself got crazy. Please zoom, zoom. Zoom, please zoom. Stop zoom. Oof. Zoom is not responding. That's okay. We can be patient. What's the problem? No responding. That's okay. Guys, see, guys, can you hear me? You know what? I will shut Zoom from here. I'm on my phone anyway now. Shut Zoom. Okay. Technology. Control. Where's control delete? Control delete. Control shift. Escape. Yep, that's the task command. That's okay. That's the one I wanted. Close program, yes. Very good, thank you. Much better. Switch, okay, I'm switching. Guys, I was talking. Sorry, guys, I was talking, but I was on mute. Guys, what's the answer to this question, guys? Guys, the answer to this question, guys? Sorry. I was talking, but you couldn't hear me. Stage 3 or stage 4? I see some of you guys say stage 3, some of you say stage 4. The answer, guys, because of this fact, you know what? Believe me, this slide, this explanation, I did it the first time was in 2018, 2019. And the ADC exam questions, right? The one, for example, in the handbook right now. If you could know this information only and you looked at this X-ray, you should have answered correct because it was similar to this one. Look, guys, and check the handbook. Check, guys, the reference. You will find it was similar to this. The bone level at this, and they told you the bone level at the bone resorption was more than 50%. Like I think 2/3 of the bone or something has been removed, has been lost, eaten away. So the answer is stage 4. Yes, it's stage 4, grade C. Now, okay, let's guys go through this quickly. Guys, scenario 3, scenario 2, scenario 1. Can you please guys tell me stage and grading for this scenario? Guys, watch guys the stage and grade for this scenario. I see answer stage 3, grade C. Stage 3, grade B. Now the problem is the grade now. Stage 3, grade C. Smoker, the second is smoking. The second is smoking. Someone now end up with stage 4. Okay, now the keywords here, guys, the keywords are, let me check, guys, we're gonna do it together, okay? Let's play this game together. 4, 5 millimeter, 5. We said 4, 5. 5 means stage 2. Stage 2. Guys, why do you think it is present to your practice complaint of sensitivity to cold? Clinic examination reveals bleed on propen. The one chart shows pocket depths of taken, and the radiographic report no generalized the bone loss. Okay, generalized. Was explained to the patient. Medical history, type 2 diabetes. Okay, this is grade B, grade C straight away. 100%. The data less than the visit was 6 months ago. Urine was professional cleaning, was reported. Guys, what did you say? Did you say stage 3 and stage 4? Why, guys, stage 3, stage 4? Now everyone is stage 2, grade C. Okay, I'm happy now. Guys, are you happy, guys, with stage 2, guys, grade C? Stage 3, why stage 3? Why not stay? Why can be? Maybe I missed some information here. Maybe if it's stage 3, why stage 3? Can be, maybe I missed some information here. Let me read again. Why stage 2? Because pocket depth. Pocket depth, we mentioned this, right? We say 4, 5, 6. Guys, we say 4, 5, 6. Okay, remember, okay. That's what we said right now. Okay, guys, you remind me with the numbers, please. I think, okay, guys, remind me with the number again. We say 4, 5, 6, 6, which is 4, 5, 6. 4 is mild, which is stage 1. 5, stage 2, which is moderate. Stage 3, stage 4. So it's 5. What do you think, guys? Clear? Okay, thank you. Let's move in this one. Focus, 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 focus. Mr. Walker, 45-year-old female, presents to your clinic with complaints of bleeding gums and mobility of her lower front teeth. Okay. So far, there is no any keywords. Clinical examination revealed that teeth 4-1, 4-2, 3-1, 3. How many teeth, guys, lost? Have grade 3 mobility, will be lost. 4 teeth. Now, severity, stage in the 6 is 4. 0, 0, 4, 5, and more. 4. Stage 3. So far, she reports having lost 6 teeth over the past. She reports having lost 6 teeth over the past 4 years. She's a regular smoker and consumes 1 glass of wine every night. Regular smoker. How much smoking? Hasn't visited generous ever in over 10 years. And her overall medical history is unknown at this stage. Grade 3 mobility. You know what, guys? This is the hardest scenario you think about. This is the hardest scenario I think. This is similar to ADC exams scenarios. I love it. The answer is very smart. Very smart. Seems like stage 4, grade C. Why? There is no direct information has been given for grade C. But know this. Severe type of bone resulting in grade 3 mobility means the amount of bone has been lost. Do you remember, guys, which is the radiographic bone loss? Ambitious smoker. One is direct, one indirect. The indirect one, the amount of bone loss. That's why I made it grade C. Smoker, and smoking hasn't been mentioned more than 10 or less than 10, but the amount of bone loss here, and guys, make it easy to you. It is too hard to have stage 4 and not grade C. Mostly grade C is attached to stage 4. Easy now, guys? Easy now? Grade C mostly attached to stage 4. You remember the scenario we made it when we said 70% bone loss and the patient 55-year-old, right? Do you want guys calculated? Looks fun. It's fun. It's just fun. Now, if you have grade 3 mobility, how much, guys, bone loss? Tell me. How much, guys, bone loss? The minimum bone loss. Grade 3 mobility, the minimum bone loss. More than 50, less than 50. More than 50. Let's calculate it. Okay, guys, look, guys, wow. This scenario is like, wow. It's a brainstorming. 50% of bone loss, patient age 45. Let's say 55, let's say even 60. Or actually make it 50. That's okay. 50% on the patient age 45. Hi, guys, the second indirect factor. How much now? Tell me. How much now? 1.1. Thank you. 1.1. You're gonna end up with what? Is it grade A or B or C? Thank you. Guys, is it fun or not? Believe me, ADC exams are like this. You read, 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 read. But when you apply it, you cannot apply it. Now you learn how to apply. That's why I always say, I teach you the critical thinking. I'm not teaching you just books, but the critical thinking, the things you really need for the exam. Did you guys get it? It's like a game you play chess, right? 30 scenario. Easy. I think that's one easy. 50-year-old. Let's now look at the keyword. 50-year-old. Okay. Tooth number 1 only. Premium brushing. That's okay. People forget about it. That's mean generalized. 6 millimeter. Stage 3 or 4. Wow. Pocket depth of 11 millimeter. Again, stage 3 or 4. Not very. Type 2 diabetes. No, 11 millimeters is rare, 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 rare. Really, it's gonna be like bone resorption, bad bone resorption. Yeah? Stage 4. Stage 4. Because 11 millimeter means like there's no bone left. 11 millimeter means no bone left. More than 50% of the bone gone. So now it's stage 4. Stage 4. Diabetes, unknown, hypertension, osteoporosis. Okay, guys, you tell me now. This is even harder. This is even harder. Oh my God. Very good. Easy now. Easy game, guys. Stage 4, grade C. You know what? That's what I always tell myself. Our candidates, we are lucky that we have our candidate the smartest ever. And they can get the things easily. Yes, I agree on this. Stage 4, grade C. Guys, how was the session, guys? Yes, doctor, one tooth can decide. The one single tooth can decide. Guys, did you have fun today? Doctor, I have a doubt. A one tooth will decide which. Yes, the worst tooth ever. That's a tooth we can decide on the stage and grading. Guys, how was the session, guys? What if bone loss is around 70% and then 50, 70 would make but less than 1? Yeah, if it's less than 1, so now we talk about grade B. Amazing, guys. Happy? Amazing, very helpful. Okay, guys, I'm very happy for you. Yes, doctor, you're right. Doctor Simran, grade B, yes. Really had a wonderful session today. I'm very happy, doctor. Dr. Bano, I'm very happy for this. 11 millimeter pocket depth means you have a bone resorption more than 10%, definitely more than 50, 60%. Say the propen depth is 6 millimeter, but here the deciding factor is 11. Yes, the deciding factor is bone, because think about it clinically, Dr. Yamuna. If you have a pocket depth of 11 millimeter and the whole root already 11 millimeter, The root length already 11 millimeter. Think about it. Means like you have bone loss more than 70%. Great session, Dr. Bido. I'm very happy, guys. Very helpful. I'm very happy. The last scenario was grade C. Why? Again, for the same reason, doctor. You have 11 millimeter pocket depth, right? Like, for example, if you have this right now, give me a second, please. Pocket depth of 11 millimeter. Look, I will show you something right now. You will understand it by this way. I will show it to you, Dr. Ram. Okay, look at this. Guys, can you see my screen right now? Doctor, can you see my screen right, guys? Okay, look at this. This is 12 millimeter root. It starts from here to there, 12 millimeter. If you have a pocket depth, 11 millimeter, like from here to all the way down there. So how much bone resorption, guys, happening? Is it more than 50% or not? And if it's more than 50, like 60%, patient age is 45. Divide now the ratio, which is 70% or 80%. 80% of bone resorption, because pocket depth 11 millimeter, like until here, 80%, divided by patient age 40 or 45. Wow, that is going to be close to 2, like 1.9. 1.9 bone ratio to the age, bone percentage to the age ratio means 1.9 means like C, straight away, right? Easy now. Okay. Imagine Dr. Angel. Guys, would you like to have session tomorrow? 11 millimeter pocket depth, Dr. Pico Pico. It was fun, guys. Do you want to have session tomorrow to pass the exam? The more guys who have sessions, I think the easy gonna be the best to understand about this exam. Great session, Dr. Bill. I'm very happy, very helpful, very happy. I already answered this one, Dr. Jilan. Please take lecture Thursday, Friday. Maybe I can take it tomorrow. Tomorrow, Thursday. Let's decide either Thursday or Friday. Yes. I already answered this one, Dr. Jilan. Thank you, Dr. Hirani. RPD design want to learn like this. RPD designs want to learn like this. How you taught luxation injuries and now Perio classification, and they will be stuck in our mind. Need to study RPD design like this. Okay, Dr. Neshma, I promise you, RPD design even will be much better than this. Okay? No problem. Dr. Shama, present loss age is what made it easy. It is easy, and I'm unaware of it till this session. Dr. Bidu. Thank you very much, Dr. Bidu. Thank you very much, Dr. Shama. I'm very happy. Did you write down all this stuff in your notes, in your book, doctor? Doctor, in scenario 2, no of tooth lost will be 10 or 6. Number of tooth lost will be 10 or 6. Will be 4. The one we are aware about it, 4. I can't remember, but I think it was 4, and in the past was actually 6. We calculate the one now because if the rest will be for Perio diseases, we added up. If we don't know, we don't add up. If we don't know the reason behind them. Dr. Ramona, great session. Unlearning and learning the things. Yes, very good, Dr. Yamuna. That's exactly what I want from you. Please, if you have any old information or knowledge, just try to delete it and get new information. Also prepare myself to have simplified the things for ADC sale. You are a big champion. Yes, that's what we do. Dr. Winnie, thank you, Dr. Bidu. Thanks a lot, Dr. Bidu. Finally learned the staging and grading classification. I'm very proud of you. Yes, Dr. Shama, I'm very proud of you. Yes, guys, I'm very happy. Great C, very good. You see, now easy now, Dr. Jailan. I'm very happy. You got it now, Dr. Jailan. More than one grade C. Very happy. Do we get calculate an exam? No, but you just like make it roughly. No problem, Dr. Tanvir. Yes, please. Love to have sessions tomorrow. Okay. Let me just get your voting then. Can we have tomorrow's session on Friday, Dr. Bidu? I am traveling tomorrow. Oh, I'm sad now. Okay, let's see. Let's decide the vote. Okay, we're gonna make vote on the page, and see, guys, your votings. Thank you, Doctor. No problem, Dr. Jaylan. It's my pleasure. Lecture tomorrow. Okay. Mock exam for laxation. Okay, guys, this is good idea. Would you like to make the mock exam for laxation, Perio? Sorry, for Perio, trauma guidelines, and prosto? That's gonna be our mock exam, just to test yourself. Yes, it will be do everything into book. I love to do this. You're great. Thank you so much, Dr. Bido. Thank you so much, Dr. Nishma. Okay, doctor, thank you so much. Okay, are you attending ADX? I'm busy to attend this stuff. Sorry. I want to attend any, but I'm very busy. I run like 6 clinics, 7 clinics, and then day and night with the ADC exam, part 1, part 2. I have no time for this. Long time. They asking me, my friends, to be there. I say, I have no time. Sorry. We get rough book and make an exam. No, yes. Fridays, we thank you, Dr. Mariam. I missed the part about calculation bone loss age, but I hope the session was recorded. I believe so, Dr. Magda. Maybe Facebook will keep it. If not, ask me, I will answer you. Great session, Dr. Bido. Yes, let's do the mock. I am in. Very good. Good idea. Mock exam for trauma guidelines and Perio classification and Prosto as well. Thank you, Dr. Saunders, very much. Thank you very much, guys. See you then tomorrow. If you vote for tomorrow, otherwise, if there is no many candidates to attend tomorrow, we can do it another day. I'm gonna post on our page, and also I'm preparing the mock for you guys as well. Thank you very much, Dr. Mahnur. I like your name. Thank you very much, Dr. Jonite. Thank you, Dr. Saunders. Thank you, Dr. Sayeda, like always. You're always doing great job. Thank you, Dr. Shiba. Have a great night, you, Dr. Shiba. Thank you, Dr. Sepia, very much. Alpha Monk, I'm up for the whole night doing the mock for you. Thank you. Thanks, Dr. Bido, for such wonderful session. Looking forward for more sessions like this. It's my pleasure, Dr. Nandi. You know what? I will call you Martin then, okay? Dr. Martin. 90. Thank you, Dr. Sharma, very much. Dr. Bido, please record tomorrow's lecture. Guys, we also guys has our for our champions, especially our private session, all of them recorded. Since 2024, we record all the sessions right now, especially the private sessions. Hi, Dr. Aditi. How are you going? Thank you very much. Thank you, Dr. Yamona. Thank you very much, you guys. Have a great night. Oh my God, 10:30. Oh, 2 hours and a half. How is this? How is this, guys? 2 hours and a half. But you know what was very fast? Imagine there are candidates start to attend the session right now, Dr. Manjut. Thank you very much, you guys. Have a great night, everyone. Thank you.